Hi, I'm Dr. Fruth, family physician, and this is the second season of Today's Consultation. Today I'd like to talk about Pap smears. Just about everybody's heard about Pap smears at some time or other. Pap smears are truly a life-saving tool in the early detection of cervical cancer. And just to highlight how important they've been, in the early 1900s, cervical cancer was the leading cause of cancer death in women. But in the 1940s, George Papanicolaou and R.A. Babet determined that sampling the cells of the cervix could be a way of detecting cervical cancer. They wrote a paper recommending annual Pap smears for women. We'll talk about success. Due to early intervention and diagnosis of cervical cancer, the rate of cervical cancer improved from 37 in 100,000 women to only 7.5 in 100,000 women by 2006. Well, it got wired into people's brains that a Pap smear every year was necessary in order to detect cervical cancer, but was determined in the 1990s that a Pap smear every 3 years was effective in adequately screening for cervical cancer. That yearly Pap smears was probably doing more harm than good. But honestly, most physicians didn't change their practice behavior. Between 1976 and 1980, a German scientist who studies viruses determined that the human papillomavirus was responsible for over 70% of cervical cancers across the world. Then in 2006, a method was developed to detect the human papillomavirus while doing a Pap smear. Well, how is a Pap smear done? A woman in the exam room lies on her back, bends her knees, and places her heels in foot rests. This is called the lithotomy position. The examiner then gently inserts a speculum, opens it, and then reveals the cervix. Cervix means the neck of the uterus, but it really looks like a chin with a dimple. An instrument then is gently used to scrape the cells on the outside of the cervix and then on the inside of the cervix, called the endocervical canal, as well. Most of the time, the cells are looked at by an automated device, but then often a human technologist will look as well. So here are the guidelines for Pap smears. If you're under 21, no Pap smears, but please get the HPV vaccination. This will help prevent you from developing the infection by human papillomavirus. This immunization is available for women through the age of 26 and men through the age of 21, except for some men who do have high-risk sexual contacts. They are eligible through the age of 26. For women between ages of 30 and 65, it's recommended to get a Pap smear every 5 years as long as HPV is done along with that Pap smear and the Pap smear and HPV are negative, and every 3 years if a Pap smear only is done. After the age of 65, no more Pap smears. If you've had a hysterectomy and the cervix was also removed for non-cancerous reasons, you also do not need a Pap smear. Pap smears are for cervical cancer detection, and if you don't have a cervix, you're not going to get cervical cancer. Your family physician is completely capable of doing your regular Pap smears, and at your annual wellness visit, along with offering immunizations and healthcare advice around cardiovascular disease, weight, diet, all those things, we can also recommend a Pap smear if it's indicated. This is Dr. Fruth, family physician, and this is today's consultation. Remember, these videos are for educational purposes, so please contact your personal health care provider for your own personal health care advice.